Okay. Everyone is very tired, right? So, me too. So I can finish up before 5:30. Don't worry about that. Just only 1 hour. It's great honor to be here instead of you, in front of you. Today is a one-day biotech lunch seminar in Thailand. Actually, this is my patient, 80 years old. Actually, he won one place implant here, number 25. Actually, my main implant is a Straumann, and then my second implant is one of Korea brand. Actually, this is my first time to place one day biotech implant. Just 2 months ago, it's my first one. So I just placed the implant, and then my feeling is very good. So actually, my implant experience more than 20 years. Even Straumann implant, I don't satisfy 100%, but I think the S-fixture, this one is one of my, I think, the best design of this implant. So from this year, I'm gonna using this implant, my second brand. My name is Wongun Chang. I train orthodontics and prosthetics, and then I'm a couple of the dental schools adjunct professor. I'm a private practice in Seoul, Korea. This is my office. My clinic is just in the outside. It's the end of a mountain. So every time we can see the nature is changing. It looks good. And then I'm the past president of Korean Academy of Aesthetic Dentistry, and then now I'm a vice president of Asian Academy of Aesthetic Dentistry, and I'm a president-elect of International Federation of Aesthetic Dentistry. So this November 13 to 15, in Korea, we have held the 14th World Congress of IFAD. So if you can come, this is a short video for the IFAD World Congress. I think everybody know about K-pop and K-food and K-culture, everything. So if you can come, you can enjoy the good, excellent speakers, the lecture, and then you can enjoy the Korean food, different culture. We prepare everything now. So please come to the Korea this year, November 13 to 15. Today's my topic is a clear aligner therapy as a key partner in prosthetic implant the patient. I'm not talking about the implant surgery. I'm talking about a little bit different thing. What is dentist role? Dentist role is we can treat our patient, optimize the patient occlusion, or we can improve the occlusion about the patient. So every treatment we do is related to the occlusion. Everything is occlusion. Especially the implant patient, they don't have a tooth. We place implant, and then what? We improve, we rebuild the occlusion. Even clear orthodontics, complete denture, and crown bridge is the same. If you don't think about the occlusion, it very the problem. If your implant surgery and prosthetics is 99.9% is success, but only 0.1%, only one patient has failed, has something problem, that patient is 100 problem. Actually, she is 25 years old, the young lady, looks good, and then she placed 2 implants, make the crown. But after she had the implant crown, she had a big problem, TMD and muscle pain and tooth pain. So actually, this implant is very famous implant dentist in Korea. But he is an actual oral surgeon. He doesn't understand, I don't know, but anyways, the implant surgery is good, the prosthetics is good, and then endodontic treatment, everything is good, but patient is a pain. And then she reported to me. Actually, her face is good, the profile is good, but she has the TMD and muscle pain, and the hip posture is not good. And then you can see the teeth. Teeth alignment is okay. But I think it's not good enough because she doesn't have enough anterior guidance. Almost edge to edge bite. There's a little open bite. Open bite means what? She doesn't have enough the mutual protected articulation. That's why the right side she has obfraction is here. And then now it's up and lower, she has some crown and temporary provisional crown. And then the TM joint shape is already changing. And then number 47 tooth, there's some widening in the PDL, but she doesn't have any pain on the right side. So I think her occlusion is not good, occlusal scheme is not good. And then also when I guide the CR position, she has a big difference, a CO and MI discrepancy like that. So it's a CO center relation occlusion, she has an open bite, this is a habitual bite. And CR position, she has only the molar is biting and the other teeth is open. So CO, there's a CR position, this is a habitual position. Whenever she bite, she hit the posterior teeth and then sliding and maximum intercuspation. The left side is the same. When you see the eccentric movement to the right side, there's a group function. Group function is okay. But the other non-working side, she has still, the interference and second molar. And the problem is the left side. She has a pain on the left side, and then 26 is a pain, and then the muscle pain on the left side. The working side, is just the second molar. There's no occlusal scheme, the guide in the second molar, the working side. Implant position is good, occlusal plane is good, but when she moved the jaw position, there's some problem. So she has a COMI discrepancy, non-functional articulation and crooked teeth, and then something happened, then TMD. So I mounted the semi-adjusted articulator. When you check, everything is the same. Right side, working side is a group function, non-working side is a interference in the second molar. The left side the same. So she has a pain because that the occlusion. So how we treat this patient? She needs a splint therapy because she has in the muscle, the pain, and then actually she needs some ortho treatment, or she can make the good crown without the interference, right? So we have see that any implant patient, we have to check the occlusion, everything. So we have to check the centric relation, the CR position, and what the patient has the occlusal scheme, and then vertical dimension occlusion, and anterior the relationship, and muscle things. So everything is a green sign. You can treat well. So the centric relation and occlusal scheme is related to what kind of function, and vertical dimension, and then anterior aesthetic is related to what the aesthetic. So we can treat the patient. It's not only the function, also the same as we can treat the essay too. So actually this is my book about this one, but it's unfortunately there's no English version. So anyway, in the ortho group, Dr. Ross group, they said they understand the occlusal scheme. So this group insists the good if the patient has ortho treatment, the result what? The patient has the anterior 6 key. Anterior 6 key is the normal occlusion, and then patient should have a seated condyle position. That means a CR position, and then patient has a mutual protected occlusion. So we have this one for the function, and also we can check the vertical dimensional occlusion and anterior teeth relationship, and then smile line, everything. So we have to see the patient not only tooth, we have checked the patient the face. So whenever you see your patient, you have to practice the observing the patient occlusal scheme. This occlusal scheme is functional, really is okay or not. And then you can see your patient all the time in the face, because the dentist the change the face, patient face. If the patient has impaired occlusal relationship, what the patient has? The patient has asymmetry and muscular imbalance of the face, and the patient has a tension and awkwardness around the mouth, and then unnatural or forced smile, and or the slouched posture, and then strained the facial expression. Or the tooth, there's a tooth pain, and then tooth fracture, the wearness, and the parental problem from the TFO, and then tooth mobility and tooth migration, and then sometimes the tooth is extraction, and then patient is a TMD. Actually, this patient is 30 years old, the dentist. She said, I have a severe pain on the lower right second molar, 47 tooth. How do I do? She said, came to me, Dr. Chang, you can treat me anything you want. Actually, her face is asymmetric, and then there is protrusion of the face. Protrusive anterior teeth, and then she has open bite, and then there's no anterior guidance. Now actually she has the pain on the number 47, and then first molar there's a gold crown, but you can see the fracture line is there. And then also she has a COMI discrepancy. So how can you treat this patient? Just change the crown or extraction and then place the implant? No, because we don't have any good occlusal scheme. We have to change everything. How can you change? We need the orthodontic treatment. Very protrusive, and then long from the low facial height, and then asymmetry. So now I treat the orthodontic treatment. I place the braces and the wire and the extraction, and then I treat the ortho treatment, and then now she has anterior guidance, and then she has asymmetric the face. So I place the mini screw, and then I change the occlusal plane. So now it's a COMI constant now, and then she has a proper anterior guidance, and then I'm done. Actually, after treatment, she doesn't have any pain in the lower tooth. Look at the face. The facial height is almost very good. The tooth is okay, and then unwriting upper incisor, and then she has a good smile line, and then symmetric face. And then lateral profile is changing, and then she doesn't have no TMD and no pain any tooth. Actually, 2 years after I follow, she is okay, and then at the time she opened her clinic in other city, but I didn't see any more her. But she is very happy, right? So I think that any dentist is the true architect of the facial aesthetic. Plastic surgeon is not they change the face, the shape, but the dentist, we can change the patient, the face, and also we can make the good function. So only dentist can do it. So that's why we need a very interdisciplinary dental treatment. So interdisciplinary dental treatment is very important, because why? That treatment can change the patient quality of life. But there is a problem, disadvantage of traditional also the treatment, because it's an aesthetic, especially the other patient, and then very discomfort, and then oral hygiene problem, and then social inhibition. So the other patient doesn't like the braces, but anyway, we need the treatment. So when we do an interdisciplinary dental treatment for the orthodontic treatment, we have to achieve the prosthodontic goal. Because the orthodontists, they have a good normal occlusion, but they don't understand the mandibular movement, occlusal scheme. So the dentist should know about the good occlusal scheme, and then we have to achieve. After orthodontic treatment, the patient should have a good occlusal scheme. So what is the good occlusal scheme? The patient has a COMI constant, and then we have to correct the occlusal plane, and then we made the proper video, and the proper anterior guidance, and then optimal occlusion, and the harmonious motion. So we have to achieve this everything so with the ortho and the implant and prosthetic treatment. So what is the benefit of clear aligner orthodontics? This is oral hygiene control. Just take out the aligner and then clean easily. The patient is clean. And then the patient wear the aligner. This is a kind of protection of the parafunctional habit, like the mouthpiece. And then you can treat the ortho and implant and ortho and restorative teeth is continuously. We can treat that. So previously, the orthodontic treatments are changed and the bracket systems are changing, but actually this is also, it looks better, but still it's not good look. So now it's a aligner, there's nothing, so that's why adult patient and young patient like this one. And then before, we don't have enough, the CAD/CAM system is a development. So now it's a dentistry, every side is a digital, it's a developed a lot. So we can treat easily with a clear aligner. Also, if you don't know about the orthodontic treatment, when you place the bracket, braces, and the wire, you don't know. If you are not orthodontist, we don't know the final, the patient, the occlusion, how we go that the occlusion, right? However, clear line is different. We can see when you see the treatment, we can the begin with the end in mind, because every system is not different, but the good the clear line system, you can see the first, the final goal, how the tooth movement you can see. So you can check the system, and then any system, I don't know, you use this system, so you can see the first time to the last time, any procedure you can see, and then in the middle you can place implant, you can treat any other tooth. So this is very good point of the clear aligner system, compared to the traditional orthodontic treatment. And then also, nowadays there is a very good tools. So when you do intraoral scan, you can see the 2 or 3 minutes, and then you can see the final, the treatment, the occlusion. So you can easily decide the treatment goal, and then you can discuss with your patient how we treat your teeth. So anyway, we do ortho-prosthetic combined treatment. We can think about the 3 categories. Pro-prosthetic orthodontic treatment. That means what? We need the implant, but there is no enough space. So we have to make the space, make the align the tooth. And then another one is orthodontic treatment as an alternative. The patient wants an implant, but you can treat the orthodontic treatment, and then the patient doesn't need the implant. And then the complicated cases we have to treat. First one is a pre-prosthetic orthodontic treatment. I can share my patient with you. This patient is a spacing between anterior teeth, and then one incisor is a congenital missing on the lower, and then flared upper anterior teeth. Actually, he is a 29 or 30 years old, the young man. Actually, he's a kickboxer, and then looks a little bit protrusive, the lip. And then she came to my office. He want to close the space with a laminate and ceramic crown. So I recommend him to orthodontic treatment, but he said, my job is a kickboxer, so I cannot have the braces. So he just close the space. However, this is not good for make the crown or laminate, because his anterior teeth and upper anterior teeth is very square already. So if you make the closer space, the tooth is more broad. This is not aesthetic. And how about the lower? She has no one anterior the incisor. There's a space. So how can you close this one? So I recommend him the orthodontic treatment, but you can treat clear aligner. If you wear the aligner, you can do kickboxing. So he understand. So he want to the clear aligner. Actually, he has missing one teeth is here. So we can make the space here and then place implant is easier, because when you do orthodontic treatment, we can push this tooth into distally, this tooth is distally, and then tooth axis is correctly positioned, and then we can place implant. However, when you see the CT scan, the number 41 position, there's no enough bone, and then 42 has a little bone, but we can place 3.0 implant without the bone graft. So a little bit difficult orthodontic treatment, but I can choose make the space in the number 42 area. He has a little bit asymmetric, a little bit protrusive the tooth. So 28 aligners he wear, and then upper tooth we just close the space, and then a little bit movement of the back side, and then the lower we can make the space number 42 area. Actually, it looks easier in ortho treatment, but with the braces it's not easy, because the upper is okay, but the lower there's no enough space to place the bracket. And then when you make the place the wire and then make the space, lower anterior tooth move forward, flare out. This is not good, because he also has a protrusion. We don't want the more protrusion. However, the clear aligners, the three-dimensionally they movement. You can movement medial-distally, and at the same time intrusion or extrusion. Also at the same time you can move buccally and lingually too. This is the first aligner he has. And then 7 months after, he wear the 28 aligners, and then we're gonna make enough space in the 42 area, and then there's no space in the upper, it's okay. But when I see the panoramic X-ray, there's an axis is not enough. So I make the refinement, additional aligner, and then he wear the 16 aligner more, and then couple 3 or 4 months after, he finished like this way. So now its axis is okay, so we can place implants very easily. So I scan and then CT, taking a CT file, and then I make the surgical guide, and then I place implant, a trauma implant, and then 2 months after, I make the provisional crown and abutment with the scan body. So this is the provisional crowns. After he has a provisional crown, we can treat the final occlusal orthodontic treatment. He has some more refinement, and then I finish up like this way. So after treatment, he has a dental treatment is okay, and then profile. His profile, the upper incisor unwriting a little more. That makes good anterior guidance, and then he looks better, and then function is better. How about the deep bite case? She is 19 years old. It's a college student. And then she had, I hope to get braces, but I had to get implant first. Because she has a very deep bite, class 2 division 2. And then she has an implant in second molar area here. Actually, I heard that she has the baby tooth on that area. And then actually she's Korean, but she studied the USA. So after graduation high school, she came to the Korea back home, and then couple of months ago, she lowered the baby tooth is out, and then the parents said, "Oh, you don't have a teeth? Go to the dentist." And then the dentist place implant, and then make the crown. But after place implant, she told his parents, I want to the braces. But previous doctors think she came back to the USA 2 months after, but he doesn't think about the orthodontic treatment. But anyway, so the patient wants the braces. His doctor, her doctor, referred to me this patient because she cannot come to the Korea every 2 or 3 months, and then she come every 1 time a year. But she wants to treatment in Korea. How treat this patient? Very deep bite. Yeah. So I'm gonna change the occlusal plane, and then I make the optimal occlusion, and then proper anterior guidance. I'm gonna keep the implant crown space. So she cannot come to the Korea, so I give the clear aligner. So make the treatment plan like this way. Because there's the implant in lower second premolar area, so we cannot movement for the back tooth lower, and then we have to correct the occlusal curve P, the flat occlusal plane, and then the upper tooth is moved back and intrusion, and lower anterior tooth intrusion, and then we're gonna make treat like this way. So I explain the patient. I'm gonna treat this sequence, and then I give her the aligner as the practice, and then I ask her dentist to make the temporary crown. So she came my office with the temporary provisional crown. I scan again. I make the treatment plan again. Almost the same treatment plan. Actually, she came 1 year after. She wear 54 aligners, and then her bite is much better. So now I can see the lower incisor, and then occlusal plane is getting better. And then temporary crown is out, but it doesn't matter because abutment, we can think this one is anchorage, so we can treat easily with this abutment. So I have additional scan and then make another treatment plan. Now it's 33 aligners. So after 1 year after she comes back, and then now it's almost okay. Occlusion is much better. And then actually full class 2 relationship is changing. Now it's almost class 1. Deep bite is correction. So she wear another 14 aligner, and then 1 year after she comes back. So I finish her like this way because I cannot the tooth movement anymore because of the abutment. So I never see her, and then I refer this patient to his original doctors to make the crown. Actually, I saw this patient only 4 or 5 times during 3 years. But she just wear the aligner, and then she can treat like this way. So now his doctors can make the good implant crown. I think everything is also good. How about this patient? This patient is a 60 years old lady. She lives in the USA, Los Angeles, and then she came to Korea every 2 times to see her mother because her mother is very old. The problem is that she has extraction the number 47 and placed implant in USA. But this implant is 5 years old. And then now it's a bone resorption and something problem is here. So the doctor said you have to, bone graft or extraction this implant and then make the new implant. But now she has a pain on number 36 and number 37. Actually, with a panoramic X-ray, it looks okay. We can extract the tooth. I think the intra-alveolar nerve is here. She has enough bone, so we can place implants easily. But the problem, the profile, everything is fine, but the problem is the tooth. She doesn't have anterior guidance, edge-to-edge bite. So now it's edge-to-edge bite. She has attrition on the lower and the upper incisor. There is no anterior guidance. There is interference on the left and right side. That's why she has a TFO all the time in the second molar in the right side. That's why the bone resorption is happen. And then now it's number 36 and 37 is a problem. When it's the CT scan, number 36 is here, there's a lesion is there, number 37 is there. So I recommend her, I can extract the tooth and place implant is easy, but you need anterior guidance. If not, your new implant, something problem with the later on. So she understands my advice. So she wants to wear the aligner first. So I extracted 2 molar and then I got extraction 1, the lower incisor, because I have to make the proper anterior guidance. So she has a 26 aligners. And then it's the first aligner. So when I give a aligner, I extract the tooth. And then she comes back 6 months after she using the 26 aligners. Now it's a proper anterior guidance is here. And then extraction area is also good. So I place Straumann implant, and then at the same time I do the scan for the make the crown, because she has only 3 weeks in Korea. So I finish up like this way. She comes my office maybe 4 times, but she can finish everything. So now next year she comes my office, probably she extraction number 47, make the new implant. However, now she has good anterior guidance. Any doctors place implant, make the implant crown, I think should be okay. She smiles much better, getting better and before. How about this patient? This patient is a almost 40 years man, and then class 3 and spacing. Actually, she doesn't need one to the braces before. However, he has an extraction in number 45, and then his doctor said, you have a class 3. So if you we make the implant crown, we need the time. So meantime, you have to brace it first, and then you have to make the good occlusion, and then you can make the implant and make the implant crown is much good for your long term. So she decided to do orthodontic treatment. In CR position, a little bit different from the habitual occlusion. So I do a bite registration in CR position and then scan by scan, intraoral scan. And then actually he went to the not braces in the clear aligner because he has a lawyer, and then she doesn't want to the braces in their client. So there's a lot of aligners, 81 aligners, like that. Oh, there's a microphone. Excuse me. No better. Yeah. So anyway, he wear the first aligner, and then the 40 aligner, a little bit move, and then class 3. In class 3 patient, it's the important thing is anterior guidance first. So I can make the anterior guidance a little bit, and then it's very easy to this movement. And then the another refinement is that, and then now it's anterior guidance, and then we close the space. Now it's the anterior space is done, closed done, and then she has the anterior guidance, and then he placed implant. Actually, the brother-in-law is a dentist, so his brother-in-law is a placed implant. And then after he has the provisional crown, I have another additional aligner, and then he finish up like this way, and then he make the crown, and then he finish up. This is actually the 2 years after the follow-up, because he moved to another city, but everything is fine. So he has canine guidance. That's good. Now, so I'm gonna explain the cases. Is the ortho treatment as an alternative. Actually, he is a 75 years the man. Actually, his previous doctor referred to me because he has severe attrition and occlusion surface, and then full mouth rehabilitation to me. But he is 74 years old, but he has no any pain on the tooth. Only he worry about the attrition. So I can do a full mouth treatment this patient. However, he has there's a deep bite, and then curve speed, and then left side is a scissor bite a little bit. So if I make the full mouth rehabilitation, he has the videos changing a lot, and then you prepare the 28 tooth. I think it's not good for him. So I recommend him, you need the braces first, because after you have a braces, you make the good occlusal plane, and then you can make some crowns for you. It takes time, but it's good for the health, and then the later on the older life. So actually, he didn't decide orthodontic treatment because he's 74 years old. But however, he comes back my office 1 month after, and then he said, okay, I do orthodontic treatment. Actually, clear aligner is very good for the intrusion of the tooth. Actually, deep bite case, the braces is very difficult to the intrusion because there's no space, the bracket on the lower tooth because there's deep bite. But the clear aligner, he just wear the aligner and upper and lower, and then we can use the bite force. Bite force make intrusion of the tooth. So only 7 months after, he has the anterior tooth relationships getting better, and then 17 months, he finished up all the treatment like that. Actually, he wear the tooth, but there's no pain. But now she has a mutually protected articulation, and then now she doesn't need any crown. Actually, he comes my office last week. Actually, the 3 years after orthodontic treatment, she doesn't have any tooth pain, any problem in the tooth. He's very happy. So even the age is not the problem for the orthodontic treatment. And then how about this patient? I have undergone the orthodontic treatment because of the TMD, but I'm still in pain. But now I'm told that I need to have an implant. I'm curious about how the treatment will proceed. She is only 24 years old, very young lady, young girl. And then she has an open bite like this way. And then he already has a 4 bicuspid extraction orthodontic treatment because he has a TMD. But after orthodontic treatment, he still have a TMD. Why? Because she has no anterior guidance. She has open bite. I don't know who treat her, but anyway, now when I guide the CR position, she has a COMI discrepancy like that. The problem, she has a TMD patient, the very, the worry about her health, only 24 years old. She has a pain, number 16 and number 36. So she visit his office, dental office. The doctor said, you have to extraction this one and place implant. But she understand if she, because any dentist said this number 16 should be extraction. She understand, but she has a TMD, so she worry about after all the implant treatment. If she still has a TMD, how can it do? So the dentist referred to me. If she need orthodontic treatment, she gonna get another the orthodontic treatment. So she has a very steep condyle inclination. Steep condylar inclination means she has anterior guidance, very important for the mutual protected articulation. So now she has open bite. So my treatment plan is like that. She has 18, the third molar is here. So I gonna extraction number 16 and then move 17 to 16 and 18 to 17. And then I think she has a severe pain on this tooth. She may need the root canal treatment, but I think the region of this defect from the TFO. So if she has enough the anterior guidance, probably I can save this tooth. So she accepted my treatment plan, and then I extract the number 16. I do a clear line treatment because intrusion is easier. So open bite is very good for the clear line treatment. Actually, with the braces, occlusion is most difficult orthodontic cases. However, as a clear line is different. So I give the aligner, and then first aligner I extract the number 16. Only 38 aligners 6 or 7 months after. Now she has proper anterior guidance, and then the 17 comes forward, and then the 18 comes, it's coming out. It's good. So panoramic is like that. And then she has a very severe pain on number 36, so we do root canal treatment. 23 months after, so now she has a COMI constant, now she has anterior guidance, a mutually protected articulation. Luckily, the molar, the third molar, comes properly. Now it's okay. And then number 36, there's a mesial defect, it's gone. I do only root canal treatment, and then she doesn't have a TFO, and then the bone is getting better. So 27 months, I finish up the treatment. So actually she comes to my office, place 2 implants. But after orthodontic treatment, she doesn't need any implant. She finish up, like this way. Now is the last one, the complicated and extensive treatment cases. I'm gonna show only 3 the patient. She's a 59 years male. I've been using the splint for 30 years, but now I'm told I need dental implant. The dentist said I might need orthodontic surgery. What should I do? Because he has a severe pain on number 17 and then 36 and 37. She extracted number 47 already. Actually, she has a very severe open bite. Like that. So actually, he wears the splint, like this kind of splint, more than 30 years. Because he has a TMD, because open bite. So when he visited 30 years ago at dental hospital, the professor said you need a tujo surgery and orthodontic treatment. But at the time, tujo surgery is very, very expensive. Even now it's expensive, but 30 years, very, very expensive. So he cannot allow the money. So he wear the splint and then he wear the splint as glasses every time. But now 30 years after, he has to extract some tooth. He need the implant, but the prosthodontist said you have open bite, you need the orthodontic treatment. So now he visited the orthodontic the clinic. They said you need the tujo surgery. So he said, if I need to do the surgery now, I did 30 years ago, but the same thing happened in 30 years. So he visited a couple of the clinics. The dentist referred to me this patient. Actually, he wears clear aligners, the splint all the time. It is good for the clear aligner. I told you, open bite is very severe. However, intrusion, especially molar intrusion, is easier treatment in clear aligner. So I recommend him. I try without surgery, and then I try to finish up the treatment with the clear aligner, but it takes time. I don't know, because this is very severe case. I'm not sure how many years I can finish. But he said, I wear the splint 30 years. Clear aligner 4 years, 5 years, it doesn't matter. Yeah. If I treat well, I can wear the aligner. So we start the treatment. I extract the 17, and then number 36 and 37, there's a severe bone loss, but he doesn't have some pain. So we're gonna remain these tooth. And then also he has a COMI discrepancy. So I do a CR position, and then I start the clear aligner therapy. 2.5 years after, now he has anterior guidance. He is happy because he can cut the noodle in the front tooth. This is very happy thing. And then 3 years, 7 months, I can finish up like this way. She's done without surgery, and then his occlusion is so good, and then profile, and then everything's fine. And then we can place implant here and here, but you know, the first molar occlusion is not bad. If he doesn't have any problem, just can remain it. And then number 36 and number 37, I think we have extraction. Probably he needs some implant. So, but anyway, he can treat aligner, you know, without surgery. This kind of severe cases, you can do it. Actually, if you are not the orthodontist, the clear aligner is very easier to learning. How about this patient? This patient is 35 years old. Look good. However, she has almost tooth is a crown. However, there's a bone loss here and here. And then there's a splinting teeth. Splinted like here and here and here and here. And then I don't know why the previous doctor made the splint crown with the baby tooth. He remained a baby tooth. Anyway, she has a severe pain in the front teeth. She needs retreatment the crown, but he has a class 3 relationship. But his dentist, I cannot renew. So he reported to me this patient. So how can you treat this patient? We have to remove the crown, and then we can see her existing the occlusal skin. But the tooth position, the class 3 is here. So how can you treat this patient? We have to make the proper anterior guidance. We have to move lower tooth back, right? So in that case, the bracket is not easy. The clear line is much easier to treat this kind of patient. So I make the impression for the provisional crown, and then this is a temporary crown because she has to wear any kind of tooth. So I fabricate a provisional single crown. I guess her original tooth position, like this way. And then if she using clear liner, I put some attachment, but the temporary crown attachment is very easy to fell out. So how I can make the attachment crown? So this is a provisional crown, and then I scan at the provisional crown to try in, and then I make the treatment plan. So now she has there's a lot of attachment here. So I gonna export the STL file with the attachment model, and then I'm merging the intraoral scan file and then provisional crown and this attachment STL file, and then I make the new provisional crown with the attachment. So and then she doesn't extract the wear out. We don't worry about the wear out the attachment. So now she wear the first clear aligner, and then only 20 align is only 3 months. 3 months after, she has anterior guidance. And then she wear another 23 aligner, actually 10 aligner more, it's okay. And then now she wear the final aligners now. But anyway, after aligners, everything, she has anterior guidance, we can make the crowns easily. We can make the implant with the bone graft, I don't know. But anyway, we can make the good occlusal skin, and then we could make the prosthesis too. So you can use the patient with the clear aligner, with the provisional crown, like this kind of way. We don't have time, so I'm gonna show the one very challenging cases I wanna share with you. Oops. Yeah, she's 23 years female, but when you see the face, she has a very severe asymmetry. The smile is not good. There is smashed asymmetry and class 3. And then she has a dentinogenesis imperfecta. So this is her habitual bite. The tooth very small, and then there's some problem the tooth. She came to she visited the dental hospital in pediatric dentistry from 2 years old, almost 20 years. But they care their composite resin treatment like that, and then she growing up, she has a class 3 and asymmetry. So this is a habitual occlusion, but with the CR position like this way. Actually, her dental clinic is not a clinic, it's a university hospital. But the pediatric dentist said, I don't know how can I treat you. So the doctor referred to her the oral surgeon and then orthodontic department. But orthodontist said, you need the tooth surgery with the braces. However, you don't have enough tooth. We cannot place the braces. So when she visited the oral surgeon said, I can, treat the tooth surgery, but anyway, you need the braces. So she just, go to the orthodontic treatment and then oral surgeon, couple of years, but there's no answer. How can you treat this patient? This patient looks difficult, but I told you previously, Koban, CR position, occlusal scheme, and then vertical dimensional occlusion, and anterior guidance. You have to resolve 4 problems, and then you can treat easily this kind of patient. How can we treat this patient? We need the tooth surgery first, this patient, because we don't place the braces. So I have to actually this is the CR position mounting, because there is interference that molar. So I extract the tooth. So now it's a CR position, and then what? I have to decide the vertical dimensional occlusion and occlusal plane and asymmetry. So I have to refer this patient to where? Oral surgeon. So I discuss the surgeon, the professor in the dental hospital. So we discuss this patient, how I want to the vertical dimension and then upper anterior tooth position. I decide that, and then he plays okay. So now it's a setup model after surgery, and then now it's digitally how he surgery like this way, and then she did the tooth surgery. This is after 2 weeks after surgery. So now she has asymmetric is okay. But the tooth has a problem. But this is 1 month after. So now she needs a tooth. So I make the provisional crown. I guess her original tooth position, because there's the root line here. Because I gonna make the her original tooth position, the provisional crown, and then I put posterior teeth, because I have to keep the vertical dimensional occlusion, and then I place the provisional crown like that. And then what? We cannot do orthodontic treatment with the braces, but clear line is okay, because clear line doesn't need the bracket. So she wear the 33 aligners, because I just realign the tooth, the tooth position, because I have to make the final crown. So after wear the aligner, tooth position is changing a little bit, and then she wear another 19 aligner, and then now it's the axis is changing, and then the interdigitation is okay, and then I place a 3 implant there. Actually, I need 1 implant here and more later on. And then what? Now I have to decide the vertical dimensional occlusion and anterior tooth position. So I prep the tooth, I make the bite, what I want, and then I make the provisional crown, like this way. So now she wear the provisional liner, provisional crowns. So actually her bite is okay, and then the face is changing. Now it's a before and after, before and after. So this is a final zirconia crown, the ceramic crown. I finish it right this way. I finish up this way. Actually, I recommend her extraction this tooth and then place implant, but she, postponed the treatment, because now she's very happy. Now she has a boyfriend, so she doesn't want to place implant. But anyways, now it's okay because any dentist can place extractor tooth, place implant, and then make the crown is make the good result because I do everything is changing. Smile lines, okay, like this way. So we can change the ortho prosto implant treatment. We can change the patient, the occlusion has changed. The patient has a harmonious jaw position, and then maybe now it's an easy and efficient oral care, and then her mind, she has a self-confidence, self-esteem. Now we can make her as a general well-being, right? So I think this is a priceless value. Who can treat this kind of treatment? Only dentists can treat like that. So actually every dental treatment is difficult. Endodontic treatments are very difficult. Perio, implant, crown, ortho, everything difficult. However, we have the responsibility for the patient life. So actually interdisciplinary dental treatment, that can change the patient life. So now if you don't you don't know about orthodontic treatment, but from now you have to make the interested in the orthodontic treatment, because orthodontic treatment and prosto collaboration treatment is another level, another world. Thank you very much for your kind attention. Thank you. I finished up 10 before 6. Thank you.